Although living with Crohn's disease can be challenging sometimes, there are medical treatments and lifestyle changes that can bring this disease under control. How do you think it feels to have a chronic intestinal disease? What can you do about it? Well, there are medical treatments, lifestyle changes, and medications that can bring this disease under control. When this chronic condition is under control, you can fully enjoy living life again. But this disease cannot be under control without these valuable treatments to help it very much. Today I'm going to tell you about an uncurable disease, which is called Crohn's disease. Crohn's disease is an autoimmune disorder because it causes the immune system to attack the intestines. This terrible event can cause troublesome and difficult symptoms such as abdominal pain, diarrhea, anemia, and even weight loss. To solve these problems, though, medical, psychological, and dietary changes will always be needed. Approximately 1.4 million people have IBD. IBD includes Crohn's disease and ulcerative colitis. Although ulcerative colitis can be cured with surgery, there is no cure for Crohn's disease. Both of these conditions share similar symptoms, though. The symptoms for Crohn's disease include abdominal pain, diarrhea, loss of appetite, weight loss, and absorption-related issues which relate to inflammation. Abdominal pain can vary from person to person, which can either be sharp and burning and never going away, like a bad bee sting, or it can either go away after a bowel movement. It can either start right before it, or it can go away right after it. For some people, it even depends on how they're laying down. Diarrhea is often one of the most troublesome and the most embarrassing symptoms of Crohn's disease. It usually gets worse if a patient is getting treatments in the hospital right before the treatment, and it usually gets better right after it. This symptom can lead to the loss of appetite, which brings the patient to weight loss. Another cause of weight loss is inflammation, which is when the intestines become red because of the autoimmune disorder. Inflammation can be treated with a bunch of different medicines, and these medicines, although they don't cure Crohn's disease, can make it 1,000 times better. The medications that are used to help Crohn's disease are 5 ASA medications, corticosteroids, immunomodulators, biologics, antibiotics, and finally nutritional therapy. 5 ASA medications are good for reducing inflammation and not the severest cases. One of the names for these medicines is Pentasa. Pentasa is a large blue pill that includes a lot of beads in it, which look like what you use to decorate desserts. Pentasa is swallowed whole and is taken down the intestines. About 75% of it is absorbed to small intestine, and then 25% of it is absorbed in the large intestine or colon. Now this medicine may cause headaches, though, because it's chemically related to aspirin. Corticosteroids are another strong medicine for IBD. Although they are good at an induction for remission, they are not good as a maintenance therapy. These medicines can be dangerous, though, because they control the blood pressure. A common name of them is prednisone. And prednisone may cause a bigger appetite and may cause an increase in weight, which can be especially bad for people who are overweight already, depending on how much weight they lost. Although this type of medicine can be dangerous, it's good for IBD, for Crohn's disease, because it controls the whole body. Immunomodulators is another helpful medication for Crohn's disease. They are not as dangerous as corticosteroids, but they control the immune system, which stops the inflammation of the intestines. they, but but these medicines may also cause some serious side effects too, which include pancreas inflammation. Biologics are one of the most helpful medications for Crohn's disease. They are IVs that are given at the hospital because they are not available in a pill. One of the examples of biologics is Remicade. Remicade is a fluid that goes into an IV, and the IV is a needle in your left or right hand, and it goes directly to the intestines. Although this medication is pretty safe, one of the more dangerous side effects is the cancer of lymphoma. Although there are a few dangerous side effects, biologics may be helpful in controlling Crohn's disease. You cannot take it if you have tuberculosis, though, but you have to have a TB test with a needle before you take it. Antibiotics are another helpful but yet dangerous medication for Crohn's disease. They reduce cracks that are outside your intestines, but they may cause nausea, vomiting, and even a metallic taste in your mouth that stays for a little while when you swallow them. One of the common names for them is Flagyl. Probably the safest medication for Crohn's disease is nutritional therapy. Nutritional therapy comes in two different common forms. It comes in either nutritional drinks, which can be the milky drink Breeze, which is similar to Boost, which is similar to milkshake, or Breeze, which is like a juice. And these symptoms may replace lost vitamins that were once there and came out in diarrhea. But if you cannot drink them, tube feeding may be necessary, which is where nutrients come through a tube in your nose. Vitamins, although are not really nutritional therapy yet, they can replace lost minerals. Lost minerals in bones and other areas are very common in Crohn's disease. The doctor visits for Crohn's disease are also helpful for medications because the doctors prescribe the medications. The doctors may also prescribe certain tests that help diagnose other problems, such as surgery, imaging studies, laboratory testing, and endoscopic exams. Surgery is also helpful. Is always helpful in removing diseased parts of the intestines. Although medicine may be better sometimes, it may be good to have surgery if one of the medicines is not working or if you're in severe pain. Easier than surgery, though, is imaging studies. Imaging studies include laboratory testing too, which can be an MRI or a DEXA scan. A DEXA scan can diagnose low bone disorders and weak bones, or an MRI can diagnose ulcers in the intestines and other problems. Fistulas are also helpful in looking for in an MRI. An MRI and a DEXA scan are very good for diagnosing problems that you would not know were there. A really accurate test for Crohn's disease, though, is an endoscopic exam. There are colonoscopies and endoscopies. They go in either way, which are tubes that go into your body and look for serious problems. These tests can start your diagnosis and help you to figure out how you can get treated for it. Although the symptoms of Crohn's disease can be annoying, medical help can bring them into remission. For most people, Crohn's disease can be put into calmness with the help of pills and doctors. Research for Crohn's disease is really progressing. I'm glad that they're close to finding a cure. I'm even going on a walk to sponsor it because I have the condition myself. There's going to be a lot of